Hi, my name is Shatina Ivy, and today I'll be discussing the role of the dialysis nurse. Before I begin my discussion, I'd like to clarify that I'll be discussing the role of the dialysis nurse from the community perspective, and I will not address the role of the acute care nurse, which you find normally in hospital settings. To begin, in terms of scope of practice, the dialysis nurse is a subspecialty, if you will. It falls under nephrology nursing. And the nephrology nursing is a specialty that addresses the protection and promotion of a person diagnosed with kidney disease. The specialty of nephrology, it looks at healthcare across the continuum from young persons, infants to geriatrics. The goal is to promote the highest level of functioning for individuals diagnosed with kidney disease, be it an acute kidney injury or end stage renal disease. Any of these things could be going on. The nephrology nursing specialty draws its scope of nursing practice from the American Nursing Association's scope of practice for registered nurses in general. The primary activities of a dialysis nurse is one that coordinates care with other health professionals, acts as a patient advocate, and works in roles such as nurse manager, consultant, researcher, and even direct caregiver. In terms of teaching and learning strategies, it's really important to note that when you're dealing with a population that has a chronic illness, one of the things to really be receptive of is the emotional state of the individual, because kidney disease, being that it can be chronic, it's important to really just hone in on the fact that the patient may have good days and bad days. So when you're discussing the status of a patient's health, it's important to first see if they're even able to receive this information. So as a dialysis nurse, you really have to be able with assessing the patient's readiness for learning. Also, training is not just for the patient, but it is definitely also for the family, being that caregivers may assist during home hemodialysis. So it's important that not only the patient is aware of what's going on, but the family, especially if the family is going to be heavily involved in the care of the patient. Okay. Also, training needs to be provided in the appropriate setting. If the patient is going to be receiving home hemodialysis, it's better to provide the training at home and not just in a room within the clinic in which the nurse is based out of. Being able to assess the patient in the home setting will also lead to better treatment. The water pressure may not be that well, or there may be other things that are at play, which the nurse will have to correct before the patient can even begin to do home hemodialysis. Teaching should also be done around the patient's schedule, as dialysis treatment can be 3 times a week, and the patient may have other things planned that they want to do with their family. So training, education should be in partnership with what the patient has for themselves, and it suits their lifestyle. In terms of teammates, dialysis nurses work with a myriad of people, from the primary care providers to the renal dietitians and also the dialysis technicians. In clinics such as the DaVita Clinic, dialysis nurses have to work hand in hand with the dialysis technician. The dialysis nurse may be the charge nurse, and she has to rely on all her staff members to help treat all the many patients at clinics such as DaVita treat. Dietitians is so important in the disease process, and if the nurse has a really good relationship with renal dietitians, then he or she can stay aware of the most recent research that's out there for the patients that she's in care of. Other teammates that are very important are the nephrologist, of course, and the pharmacists and technicians. Oftentimes, when the medication needs to be changed, the nurses are the frontline helpers in that. They can talk to the nephrologist and the pharmacist and say, hey, I noticed a change in the patient's status, and maybe we can revisit the treatment plan. The dialysis nurse has to wear many hats. For those that are doing home therapy, the ability to teach, just having the equipment knowledge, past experience of peritoneal or hemodialysis experience is a key, and the ability to assess patient readiness for learning. If the patients just come back from dialysis treatment and they're very tired, this may not be the best time to educate them or find out how it may be better to just give them an opportunity and find out when's the best time to discuss their treatment plan. If a dialysis nurse wants to do home hemodialysis, it's very important that they are able to train and educate in the home setting, knowing that they'll have to use the patient's equipment at home, and being able to be well versed on the different types of home therapy that's available. It's important that the nurse have a lot of confidence and experience, as well as excellent communication skills, keeping in mind the educational levels of their patients, because that's an important factor. In terms of educational preparation, a registered nurse can work within this specialty without having to have advanced education such as a master's degree or a nurse practitioner degree. However, after 2,000 hours of work experience over a 2-year time frame, it's recommended that dialysis nurses sit for the certified dialysis nurse certificate. Some of that entails not only just having the minimum of 2,000 hours, but it also entails having 20 contact hours of continuing education. In terms of the exam itself, it's $350, and it's about 170 questions on the web for 3 hours with a 70% for passing rate. If a nurse isn't able to go into that specialty upon graduation, the DaVita Clinic offers a STAR dialysis nursing training program. It's a 9 to 10 week paid training program, and DaVita has about 1,500 clinics across the U.S., and they're even opening up to the international sector. So that would be beneficial for possibly nurses who want to work abroad. Some of the highlights of the dialysis nursing during my research was that by the year of 2020, the number of patients with kidney failure is expected to rise to 774,000 patients. So as adults continue to age in America, there'll be a lot of opportunity for nurses to pursue that specialty, especially if working in the community is something that you're really interested in doing. I thought it was also interesting that you didn't have to continue into a master's program to work into the specialty, but it was really based on your experience. And also the fact that nurses could work in acute care, they can work in the home setting, they can work in a clinic. So I thought that this specialty was nice in that sense, that it allowed you to work in different types of settings without having to maybe go back to school right away to pursue a master's. So I thought that was good as well. Also, that this specialty is founded on nursing theories, such as Jean Watson and her theory of human caring, as well as Dorothea Oram, who has a self-care deficit nursing theory. And it just made sense that the dialysis nurse was built on Jean Watson's theory of human caring, because it being that kidney disease is a chronic condition, the ability to be able to care for someone when they're having bad days or just not feeling well, and while still being a nurse and their advocate, I think that it goes hand in hand, having Jean Watson theory as a grand theory for nephrology and in turn dialysis, and of course the self-care deficit, because the nature of dialysis treatment, the patient is unable to care for themselves. So I didn't think that was a surprise either about it being built on a self-care deficit nursing theory. These are my references, and thank you for listening.